Hey there, you're welcome back to my channel. This is Beatrice, aka Ordinary Girl. So in today's video, I'm going to be talking about PCOS. If you're hearing this for the first time, I hope you stick here. Even if you've heard it before, just stick with me as I share a little bit about PCOS. Now, what is PCOS? PCOS is Polycystic Ovarian Syndrome. Yes, it is a health condition that affects women. Now, I'm talking about PCOS because I realized that PCOS has become quite common, but it goes undiagnosed a lot. So many people are suffering or struggling with PCOS, but they don't know what they are struggling with. They just keep treating the symptoms without even realizing what they are dealing with. And it's very dangerous because PCOS can get into like several complications. It can be a cause for infertility. It can affect your normal physical health. It can also affect you psychologically as well. Just stick with me in the video and you'll get to see how these things can happen with somebody with PCOS. Now, as I said, PCOS is Polycystic Ovarian Syndrome. Now, what happens in Polycystic Ovarian Syndrome is that there are many factors that come together to affect the body, that's the reproductive system of a woman, and then it leads to this syndrome. Now, some of those things are controllable while some are not. For the purpose of this video, I expect that not everybody in my audience is a medical personnel. I'll try to explain this in the very simplest of terms as much as I can. So most people with PCOS do not have like proper insulin secretion, or the insulin might not be sensitive enough to break down the sugars and carbohydrates that they take into their body. Now, this is something that the person cannot control. Now, PCOS can also be a combination of inactivity or lack of exercise. Now, this is what someone can control. So that's why I said it's either controllable or uncontrollable. And then the other aspect is the hormones. You can't really control the hormone part of it. The risk factors for PCOS. What I mean by risk factors is what it is that you would see in your life that you will know that you are at higher risk for PCOS. Doesn't mean that automatically you get PCOS, but then you need to be more careful because these are risk factors. Now, family history is very important. If you come from a family where they've had issues of infertility in the past, or they've had issues of oligomenorrhea, that is irregular periods, or they've had issues of diabetes, obesity, these are all risk factors. Do you know that in Nigeria, over 100,000 people are diagnosed with PCOS every single year? Yeah, just think about that fact. Like, that is a huge number for a country like ours. And the problem is, it's not even just in Nigeria. All over the world, PCOS is on the increase in India, in UK, in US. Just check out the statistics. You will see that a lot of women are suffering from PCOS. And one thing I want you to bear in mind is that it goes undiagnosed most of the time. So imagine if these figures are not even all of it, because some people don't even get to know that they have PCOS ever. Now, what are the symptoms of PCOS? You know, as I'm talking, I'm sure you're already wondering, okay, is it something I should be worried about or not? One of the most common symptoms of PCOS is uncontrollable weight gain. You just realize that you're gaining weight you can't control it and you can't really explain it. Yes, unexplainable is a better word to use. Like, you can't even explain why you're gaining weight because you probably you're not doing anything that should make you gain weight, but then you are gaining weight without an explanation for it. That is one symptom of PCOS. Then another symptom is increased hair growth. Now, I'm not talking about just hair growth on your head. Now, hair growth in places like the underarms, the navel, around the navel, around the nipples, like you just notice under the chin, you just notice that there is an increased hair growth, excessive hair growth. That is another symptom of PCOS. Then another symptom of PCOS is obesity. Yes, weight gain, of course, and then it can lead to obesity. They are all in line. Yeah. Another common symptom of PCOS is acne, like acne that becomes quite uncontrollable. Like, I'm not just talking about the acne you get as PMS or anything, but this acne requires clinical attention most times. Like, you get, so this acne is quite persistent. It requires people to actually see a dermatologist, you know. Acne that you, painful acne, like acne that you can't really control. Irregular periods, that's another symptom. If you notice that maybe if you calculate the number of times you get to menstruate or have a menstrual cycle in a year, it might not, it's once it's less than 9, that's the sign of irregular period, because your period days, as period cycle is definitely more than 35 days for you to be able to for you to just menstruate less than 9 times in a year, because we have 12 months in a year, and then of course regular cycle is about 28 days, and if you look at that, then you should menstruate every month at least. But then if you get to menstruate less than 9 months in a year, then for you to look into it, that explains irregular periods. And then another symptom could be painful periods, like extremely painful periods, even though not always, but then it is something. Now, when we say symptoms, we are not saying that you must have all of this for you to have PCOS, or we are not saying if you have all of this, then you have PCOS. You might have these symptoms, but it might not be PCOS, it might be something else. So that's why I would advise, and I always advise, if you notice any symptoms, go to the hospital and get checked. PCOS can only be diagnosed when there are some tests that have been carried out to ascertain that really this could be PCOS, because there are other diseases that have this same set of symptoms. So you cannot just go ahead and start treating PCOS or say, oh, I have PCOS, when you are not sure. You need to go to the hospital and get proper diagnosis. Thank you. Sometimes it just does not stop at PCOS. It can lead to other diseases. It's a risk factor. PCOS itself is a risk factor for other diseases, and some of those diseases are cardiovascular diseases, that is things that have to do with the heart, cerebrovascular diseases as well. Then it can also be a risk factor for miscarriage. You know, some people have miscarriages and they really cannot explain it. It could be PCOS. It's also a risk factor for infertility. Some people struggle with infertility as a result of PCOS. It could also cause a person to take longer time to conceive. Let's say you're trying to conceive but you're unable to conceive. It takes longer for you to conceive. It could also be PCOS. Another thing that PCOS could cause is increased blood sugar. You have increased blood sugar, which will lead to diabetes mellitus. That's type 2 diabetes mellitus most times. So now I've been talking about PCOS and it's just looking like doom, like what's she talking about? So some people are already panicking, oh my god. No, there's no need to worry. I'll give us how to manage PCOS. Notice this does not mean you should not go to the hospital. You have to go to the hospital, but these are things that you can do to manage PCOS. Yes, I'll talk about that in a minute, but before I do, I want to share a story. Yes, this is a case study. If you're familiar, if you're a medical person, you understand what a case study is. So it's a case study that I read online, so I'm going to share it as a story. There's this young lady, very young lady. She's a medical doctor. Okay, let's call this lady. I don't want to use the name of the lady on the case study, but let's give it a random name. Let's call her Flower. Yes, because I'm wearing a flowery top, so let's call her Flower. So Flower was a young teenager who loved life. She loved going to school and everything, but then Flower had severe acne growing up. Like, her acne was very bad. It was very her acne was very bad and all that, and it affected her self-esteem. Now, remember earlier I said that PCOS can also affect you psychologically. Now, this is one way. When you look at acne, you look at weight gain. Those two things, they are enough to tamper with someone's self-esteem and mental health. So yes, Flower had severe acne growing up as a teenager. She was always teased for it and all that, and she never really knew what it was. Her parents took her to the doctor, of course. She was prescribed with some antibiotics. She used antibiotics, she used some topical creams, she used different things for the acne, of which she got better, and she was really grateful for that. But then it got to a point where she realized that the acne was just not going completely. It was beyond the normal acne. You know, yes, acne is quite normal, especially as an adolescent growing up and all that. It comes with growth and all, but then this was beyond the normal. She noticed that it was quite beyond the skin and all that, so she went into medical school. So while in medical school, she started learning about PCOS, and she started suspecting that maybe I have PCOS. It might not just be ordinary acne, because from the symptoms that I'm learning, then it's probably because she started gaining weight when she was in medical school. When they were posted to a particular unit, she noticed that she gained a lot of weight in just a month, and it was a bit of a concern for her and all that. So she was like, okay, now I know about PCOS. You know, they say what you don't know won't kill you. Like for years she has been struggling with PCOS, but the only symptoms she knew was acne and all that, and she didn't know what PCOS was, so it was not really like a bother. But now she knows what PCOS is, and she's seeing herself with symptoms that look like what she's learning in the books. So she started getting worried. Okay, I'm gaining weight, I'm still having acne, the acne is worse and all that. Now the acne was painful and everything, and she decided to go for medical investigation. And she underwent some tests and everything, and at the end of the day she was diagnosed with PCOS. Now what did she do? She decided to go into lifestyle modification, which is what I want to share with us. Now lifestyle modification is just you modifying your lifestyle to improve your health. So there are lifestyle modifications that are associated with PCOS that help to manage PCOS. Number one is diet. Diet is very important in the management of PCOS. For the sake of this video, I'm not going to talk about any drugs, because this is not a platform for prescribing drugs, so that's why I would encourage you to go to the hospital. So I'll only talk about lifestyle modifications. She started dieting because if you have PCOS, your body is not able to process sugars and all that properly, so you need to take less carbohydrate, less sugars, and take more protein. So that was what she started doing. She reduced her carbohydrate intake. If you can, cut it as much as you can, and then take more of proteins. You know, legumes, plant proteins are more preferable to animal proteins. And then another lifestyle modification is exercise. Exercise is very important. It helps you to burn sugar, burn calorie, burn excess fat and all that. So exercise is very important in managing PCOS. The thing is managing weight. Like you have to be intentional about managing your weight, because this weight gain is something you can't really control and it's unexplainable. So you have to take steps, you have to be intentional, you have to watch what you eat. It still goes back to dieting and exercising and doing everything that you can to make sure that you manage your weight, because the more the weight, the more risk for cardiovascular diseases. So that is that about that, and I just hope you've learned one thing or two about PCOS. I'm putting up a challenge to you. Make sure you visit the hospital today and see a doctor. Put it on your schedule. Let it be one thing you want to do at least before the end of the month, or at the beginning of the following month if the month's already coming to an end too soon. Make sure it's something you really want to do. Go for a test, go for checkup. I would always encourage routine checkups are important. Go for checkups. Manage your health, live a healthy lifestyle, and I do hope to see you in another video. Thank you for watching. Please like, share, and subscribe. Bye.